Dr. Angela. I'm a cosmetic and restorative dentist at Your Smile Clinic in Manchester. And today I'm going to be talking to you about composite bonding and composite veneers. It's a super popular treatment at the moment in dentistry, and it seems to have gotten really popular in the past few years, probably because of social media. In this video, I'm going to explain exactly what it is, what it's used for, who is suitable for treatment, what happens during treatment, and what the risks of treatment are. I'll also be covering how long it lasts and what type of maintenance is required. There's quite a lot to get through, but if you are thinking of having composite bonding, make sure you watch this video. And if you find it useful, please don't forget to like and subscribe. So let's get into it. What is composite bonding? Composite bonding and composite veneers is when we add some tooth-colored resin called composite to the surface of your teeth. Composite bonding or composite edge bonding is when we add the resin just to the edges of the teeth, for example to the tips of the teeth or to the sides. Composite veneers are when we cover the full front surface of your teeth. Some people do use these terms interchangeably, so it can get a little bit confusing, and you can also have a combination of composite bonding and composite veneers as part of the same treatment plan. It's a really versatile treatment. We can use it to repair chipped teeth, close gaps, we can change the shape and size of teeth, and in some cases we can even change the shade of the teeth. When we use bonding versus veneers depends on what your main complaint is, what the current position, shape and shade of teeth are, and what type of results you're looking to achieve. For example, if you have a few small chips but you're generally happy with the shape, position and colour of your teeth, then composite bonding is generally preferred. However, if you're looking to correct the shape or size of the teeth, if you want them to look a little bit more aligned, or you want them generally a little bit whiter, then we may need to cover the full surface with a composite veneer. It's really popular because it's a more affordable alternative to porcelain veneers. It usually doesn't require any preparation to your natural teeth. However, there are still some risks with the treatment, which I'll talk about later. Who is suitable for treatment? So your suitability for treatment will depend on what you want to achieve, what the current condition of your teeth are, and this can only really be assessed following a thorough face-to-face examination. The dentist will assess your teeth and gums as well as your bite. If you have any dental issues such as dental decay or gum disease, this would need to be treated before we can start treatment with composite. If you clench or grind your teeth, we'll also need to do some further investigations before we can start cosmetic work. And if your teeth are misaligned, then usually you will need to have orthodontic treatments such as braces or Invisalign. If you didn't have them straightened, then your results may be compromised. It's also usually a really good idea to complete a course of teeth whitening before composite bonding or veneers because the composite doesn't whiten. So what happens during treatment? First of all, we'll take a shade and then we'll prepare your teeth by isolating them to keep them clean and dry. We'll use either a retractor or a rubber sheet called rubber dam. We then roughen the surface of the teeth and apply some dental glue. Then we sculpt the composite to your teeth. We can either do this freehand or by using a template. And finally, we would set it with a light and polish and shape it. It doesn't usually require any anaesthetic, and the treatment is normally complete after a few hours depending on how many teeth have been treated at once. What are the risks of this treatment? The main benefits of this treatment is that it's a relatively inexpensive way to upgrade your smile compared to other treatments. It's often advertised as no preparation required to your teeth, so safer than traditional porcelain veneers. However, it's not always the case. Some cases still require preparation depending on what your goals are and what the position of your teeth currently are. Some people also think that it won't damage the teeth at all and that the treatment is completely reversible. Yes, we can remove the composite if you've had no preparation, but it has to be done very carefully and with magnification to prevent damage to your enamel. However, microscopically there could still be some loss of enamel. You can also get decay under composite veneers and bonding if they're not looked after, the same way that natural teeth can decay. So it's still really important to look after them and get them checked regularly. One of the main drawbacks with composite is that it can chip and stain with diet and with wear and tear, so you will need to go back for repolishing and repairs. It normally lasts around 3 to 5 years, sometimes longer if you're careful. However, it can chip and stain much sooner than that if you don't look after them. So you have to be really careful with what you eat and avoid certain habits. You would need to avoid biting hard or tough foods. You need to avoid biting nails, opening packets with your teeth. Basically, don't use your teeth as a tool. If you clench or grind your teeth, it's a really good idea to get a bite guard made to protect the composite. As always, it's very, very important to speak to your dentist if you're considering any treatments. But I hope you have found this useful and informative. A dental assessment and consultation will be tailored to your specific concerns and will be able to advise on which treatment would be best for you. If you have any questions, please feel free to leave a comment. Thank you so much for watching, and I'll speak to you guys soon.